Hello and welcome to HeartSense's Fireside Chat series. Today's episode will be focused on determinants of care. I'm so excited to be able to speak with Dr. Antoine Keller, our co-founder of HeartSense, and Dr. Ronald Andrews, Chief Medical Officer for Bring Back Louisiana at the Louisiana Department of Health. Dr. Keller and Dr. Andrews, thank you so much for joining me today.
Thank you very much, Sabrina. I'm really excited to have Dr. Andrews on today because he is our expert in Louisiana about all things COVID and all things having to do with vaccines and preparedness for whatever might come down the way. So one of the things that we have found in our collaborations in the past is that the COVID pandemic really exposed a lot of inadequacies in the structural healthcare system that we have in Louisiana. Mm-hmm. And not only do we have issues related to access to COVID testing and vaccinations, which I'm sure Dr. Andrews can elaborate on better than I could, but these inadequacies spill over into other things like cardiovascular disease. And a lot of it has to do with structural inadequacies, but there are a lot of cultural and social things that actually come into play as well. So that's why I'm really excited to have Dr. Andrews on, because as a primary care doctor, he sees these things firsthand.
Thank you for having me. I'm glad to be here discussing this very important topic about, health disparities, social determinants, cultural determinants, health equity, if we may call it. It's so many things interplay with each other that ultimately impact the bottom line of health. And if we want to say health is the new wealth, or if you don't have health, you don't have anything. So It's very important, and I'm glad to be here. And I hope that whatever we share can bring benefit to the community.
Great. So let's kind of just go over the terminology for the community. So first question, what are social determinants of care? And I'll start with Dr. Keller.
Well, there are a lot of things that go into whether someone actually has access and receives the care that they need from a healthcare perspective. Social determinants are things that happen in the community that will allow someone to be able to present to a healthcare provider that can help them with whatever problem they have. Some good examples of social determinants are things like proximity to healthcare. One of the most significant issues we have in the healthcare system is that sometimes people live very far away from where they can get adequate care in general, and certainly specialized care specifically. There are other things that, not just transportation related issues, but there are technology related issues and issues related to whether someone lives in a rural area or an urban area. All of these things are eminently important and speak to our societal constraints on the delivery of healthcare.
Yes. And also some other determinants for social might be the education and income that's coming out of, like you said, those rural populations versus more of like a metroplex type environment that people are living in.
Yeah. Food access and food insecurity is a really interesting topic, because there are places in urban communities where they don't have access to fresh fruits and vegetables, or there are places in inner city areas that don't even have access to physicians in general.
Yes, and I think that's a great jumping off point for Dr. Andrews. So Dr. Keller had mentioned the whole concept that there aren't physicians even in particular zip codes. And I recall that you mentioned that in the Echo Frontlines video when they featured HeartSense. So kind of going hand in hand with social determinants, what are cultural determinants of care? And I will hand that off to Dr. Andrews.
No, definitely. Thank you. And I see that you saw that segment on Echo, because it's so true. So when you start talking about really both social determinants and cultural determinants. That event that HeartSense had, at the church in Baton Rouge, I think it's the 70, maybe 802 zip code. I'll just throw that out there for any and all that want to look it up. But there are zip codes in a metropolis that, there are, just as there are food deserts, there are healthcare deserts. And there are just not physicians on a regular basis in that particular zip code where we were that day at the church. And those things affect the healthcare that is received and delivered. But then that lends itself to the cultural determinants that you were mentioning. And that gets away from just more of race and ethnicity, but starts getting into, cultural beliefs. Use, language and dialect and comfort with your provider, like a patient-provider concordance. So that it's one thing for a large system to say, we're going to put a clinic in that zip code or any, impoverished area. But then if you open a clinic and none of the providers, from the person at the front desk to the physician, nurse practitioner, or physician assistants, resembles any of the patients that are matriculating through the facility, there's a disconnect. And then those providers, unfortunately, probably are not comfortable or aware of some of the cultural norms, when it comes to a patient and provider, treatment options, and other logistics that come into play with the social determinants that happen outside of that clinic visit. And those things definitely, if you're not aware of them, impact healthcare and the bottom line. So they're both equally important, but they both play a role in a patient's ultimate, health and care that they receive. So it's just being aware, but it's not completely possible to eliminate those things. But it's one thing that if I can't see into what you do on the weekend, where you go home at night, what's available to you as far as food choices, affordable housing, safe housing, and your other background information, it's hard for me to really be able to devise a appropriate healthcare plan that's reasonable for you. So a lot of people talk about the social determinants, and we can throw a lot of money and policy and everything at them. But if you don't acknowledge the cultural determinants, then you'll miss the mark. It'll be a lot of resources wasted because the people won't be open to what you're trying to provide for them.